Hello there, my name is Dr. Kevin Greenspan from Greenspan Wellness Center. What I would like to do is to thank you for making it this far trying to figure out how better to deal with your neuropathy. So first of all, I'm going to really encourage you to make an appointment for a consultation and exam and then keep that appointment, because what you're going to find out at that appointment, number one, is that there are over 100 different causes of neuropathy. And what is causing the symptoms of neuropathy is happening before you're actually having your symptoms. So the numbness and tingling, the burning pains, the balance issues, not being able to sleep at night because your feet feel like they're on fire or that they're freezing and you're kicking the covers off, finding you needing a cane, or maybe you're even progressed to the point where you're in a walker. And you certainly don't want to have any amputations if you're a diabetically induced neuropathy, okay? But what I wanted to let you know is that long before all of those symptoms started happening, you were having an issue with the blood flow and the oxygen going to the nerve cells in your feet and your hands being cut off. So let me explain to you how that happens, okay? So at first, again, this is, let's just say this is a model of your nerve cell, and you've got millions of these in your body, okay? And you've got them in your feet, the peripheral nerves in your feet and your hands. But let's just say that this is the nerve cell, and that my fingers represent the different blood vessels that are bringing the vital oxygen and nutrients into that cell. So before all of those symptoms start, what's beginning to happen is because of the causes of your neuropathy, and we said there are many of them, the blood flow is being diminished and these blood vessels are shrinking and shrinking. And so what's happening is as they're shrinking, there's less oxygen and nutrients to that nerve cell body. And then all of a sudden they just shrivel up and they're just not able to breathe at all. And now this is when you're having all of these symptoms occur. So the process starts. Your process, you're going to the medical doctor, find out why you're getting these crazy symptoms in your feet. All of a sudden, he refers you to the neurologist. You're given gabapentin or Neurontin or Lyrica, some different types of medication. Maybe you're going to a physical therapist for the balance issues. These are not solutions. None of this is fixing that neuropathy. So I just wanted to let you know that the programs that we have actually reverse the damage from the neuropathy. So we utilize modern technologies, lasers, instruments, light sources, red light therapies. We changed your food. There's different supplements that we have you take that all heal up these damaged blood vessels and nerves. So what happens is as soon as you start to heal up that damaged blood flow problem, now all of a sudden those blood vessels are getting healthier. You're getting angiogenesis, which is a recreation of new blood vessels to replace the ones that are damaged. And all of a sudden the blood flow is restored to that nerve cell, and now the symptoms start to go away. The numbness and tingling goes away. The quality of your life is returned. So once that blood flow is allowed to go back to that nerve cell body, it heals up. Human bodies, like all animals, have an ability to heal up as long as all the pieces are in play in the body, in the organism. In other words, let's say you've all had a cut before, right? So let's say I cut my finger and it bleeds. Now, I don't need an instruction manual how to figure out how to stop the bleeding. As long as you can keep those two pieces of your skin together, your body will actually create blood clots. It'll create new fibrin, new elastin, new tissue that will just slowly mend that all up. So when your body is exposed to the appropriate healing environment, it can heal up. And that's what our programs do.